My name is Dr.Arora, I'm a GP and aesthetic doctor, and today I'm going to be answering all your postpartum skincare questions for Nessa Organics. So to start off with, let's talk about what happens to the skin during the postpartum phase. So postpartum is the phase that occurs once baby has been delivered, and what normally happens is those lovely hormones that we had during pregnancy start to plummet. So during pregnancy we have hormones like estrogen, progesterone and beta-HCG. And we have high levels of these hormones, and these hormones coupled with increased blood volume can give us a lovely glowing complexion to our skin during pregnancy. Once the baby is delivered, those hormones take a nosedive and drop down, and therefore we have reducing levels of the estrogen, the progesterone and the beta-HCG, and this can result in some common skin complaints. However, the causes are not just attributed to hormones, there are other causes as well. So let's talk a little bit about the main complaints that we see with postpartum skin. So the first really common one is that we'll often see breakouts, oily skin and acne. And this can occur because obviously the hormone levels are dropping and we're starting to see more oily, congested skin. One of the second really common complaints of postpartum skin is hyperpigmentation. So hormones can drive this, and often you'll see large blotches of pigmentation on the skin, and this is commonly known as melasma or the pregnancy mask. Alongside this, you may notice more redness or blotchiness of the skin, and some women notice spider veins, for example. And another really common complaint actually is dryness and irritation to the skin, so pregnancy dermatitis or postpartum dermatitis on the skin as well. And so these are really common complaints that we see, and we're going to talk a little bit about what we can do to get on top of those things and to manage those during the postpartum phase. Okay, so my advice to new mums would be to gently ease yourself into a structured skincare routine. This is really important, not just for self-care, but to ensure that you're targeting those postpartum skincare concerns. So the first thing that I would say is it's really, really important to ensure that you are cleansing your face using the appropriate cleanser for your skin type. So if you've got congested, oily skin, use a gel-based cleanser, and if you've got more dry, irritant skin, then obviously use a cream-based or gentle cleanser on your skin. The second thing that I would say is really important is to ensure that you're using SPF. Now, obviously during pregnancy, because of your hormones, some women may suffer with the pregnancy mask or melasma, and this may carry on into the postpartum phase. So if you are having hyperpigmentation, it's really, really important to ensure that you are protecting your skin from further pigmentation by using a good SPF. So I would say a broad spectrum SPF, around 50, and with a UV rating of 4 to 5. If it covers infrared, even better, as we do know that infrared heat can also worsen melasma. So SPF, cleansing, really important. I'd also say that it's important to moisturize your skin, especially if you've got dry, irritant skin, to ensure that you're helping that barrier to strengthen and that you are helping your skin to stay hydrated as well. The fourth thing that I would say that's really important is to ensure that you're using ingredients to target your blemishes. So if you have got blemished skin or marks or acne, it's really important to use a product that's going to help control that and to get on top of it. So if you're not nursing or breastfeeding, you can go on to using a product like retinol, for example, to help with that cell turnover, to help upregulate elastin and collagen in the skin, to help with the anti-wrinkle effect. But if you are nursing, then that may be a struggle, although there's not a lot of research out there to suggest that retinol will cause issues during breastfeeding. A lot of the guidance says not to use it if you are breastfeeding or nursing. So I think if you're worried about that, I would wait until you've stopped breastfeeding to use a product like retinol. However, there are new products out there like Bakuchiol, which is a brand new sexy skincare product that's come out, and it does work similarly to retinol to increase cell turnover and to give you a nice glowing complexion. So a product that again you may be able to use during the breastfeeding phase. But aside from that, there are other products that you can definitely use during the breastfeeding and nursing phase and even during pregnancy. Products like azelaic acid, so another active ingredient that will help with blemishes, marks and acne, oily skin as well. So I'd say step number 4 is to incorporate into your skincare routine any active ingredients that will work on the skin to target certain concerns that you have. My final tip would be to ensure that you are getting some rest. That's really important, not just for your mental well-being, but also to ensure that your skin's getting the rest that it needs. When we're sleeping, our skin repairs and heals. So try and get some rest if you can. It can be difficult with a newborn baby, but try and nap when they're napping. If you've got somebody who's helping you, try and take a break from baby and go away and have a few hours sleep. This is important also for dark circles, puffy eyes, etc. that can form when you are sleep deprived as well, which again is a major complaint in the postpartum period. So I hope those skincare tips are useful, and I'll go on to answering some of your more targeted postpartum skincare questions. And the first one is postpartum acne, how can we treat it? So if you think about the cause of postpartum acne, that change in hormone which is leading to excess oil production in the skin's glands, and then that oil is getting trapped into our pores, we're getting dead skin cells in there, P. acnes is skin bacteria all multiplying, and together this is causing congested skin leading to breakouts. So the way to treat this is to ensure that obviously you've got a really good skincare routine in place firstly. So you want to have a gel-based cleanser to get rid of the oil on the skin surface, and you want to go in to use a really good toner, so something that's going to be either salicylic based if you're not nursing, or something that's going to be aimed towards acne oily skin that you can use when you're nursing. So La Roche-Posay do a few gentle gentle toners for the skin, which is for acne prone skin, so you could try those. What I would say that's really important to consider is obviously active ingredients with acne. So if you are not nursing, it's really easy to go ahead and then use a salicylic based cream or gel on the skin to target those spots. It's also then okay to use benzoyl peroxide, which is another ingredient that we use to dry out spots. So if you're not nursing, then you can go ahead and use these products. If you are nursing, it's slightly trickier, as although we don't know what these products do to this, are going to do if you're nursing, there's not enough research to show that it's going to cause harm or not. So we err on the side of caution and we just say don't use them during nursing. But there are alternatives that you can use. So I mentioned azelaic acid. That's an acid which comes from wheat and yeast. It's naturally occurring, and it targets acne oily skin and also targets blemishes as well. So you could use an azelaic acid on the skin to help target those congested areas as well. So that's something you could definitely do. Another really important thing is to ensure that you are being consistent with your skincare routine. So doing it every morning and evening, and following it up. Once you've stopped nursing and once you've you're well into the postpartum phase, you can then go in for some more in-clinic treatments. So you may have a chemical peel done, for example, which will help to reduce any marks on the skin and can also help with acne and oily skin as well. So there are definitely options available out there. But the first step I would say is to ensure that your skincare game is in order to get on top of the oil and the grime on the skin causing those breakouts. So what are the most effective treatments for melasma? Okay, so melasma is obviously the hyperpigmentation that I mentioned earlier on the skin surface, and this is hormonally driven, but also can be exacerbated by the sun's rays. So the number one treatment and prevention for melasma would be to use sun protection SPF. So it's really important that you use this on the skin every single day, even if you're indoors, because you can get light obviously from your phones and from the window, and this will all affect the pigment on the skin surface. So really important to have an SPF 30 to 50, UV rating 4 to 5, and if it covers infrared rays, really, really good. One of my favorites is Helio Care, which covers everything, so check that out if you're looking for a good sunblock. So yeah, that's really important. I think to obviously target the melasma and the pigmentation that's already on the skin surface, you need to use something that's going to help lighten that. So that could be a prescription grade product like hydroquinone, which you can have from 2 to 4% prescribed to you to help lighten those marks on the skin surface. For darker skin types though, and for more sensitive skin types, hydroquinone can be quite irritant on the skin. So it might not be suitable for everybody, and if that's the case, then we may want to give you something that's got natural lighting agents in them like kojic acid and arbutin, and we can give you a lightening cream that is based with more natural ingredients like those, and we can use those to lighten the skin's darker areas. So topical treatments are really popular for melasma. We tend not to use lasers in melasma commonly, and that is because the heat from the lasers can make melasma worse. That's not true for all cases, but again, if you were going to have that treatment done for resistant melasma, you'd have to go and see your aesthetic doctor or dermatologist to get a full consultation. But generally you can use these topical ingredients to help lighten the skin, and again, azelaic acid is another really good one to help prevent further pigmentation and to help lighten pigmentation as well on the skin, because it's a chemical exfoliant. So those ingredients generally work well for melasma on the skin. So the next question I've been asked is about red patchy skin on the face and what causes post-pregnancy dermatitis. So both those are very similar things. Dermatitis is basically where the skin becomes irritated, red, flaky and itchy. And this is normally due to an imbalance in the hormones again. This can lead to the skin becoming more dry than usual, more irritated than usual as well. What's really important with post-pregnancy dermatitis is that you're treating your skin gently. So use a gentle cleanser and a moisturizer that's going to help repair the skin's barrier. So I would advise something like Cetaphil gentle skin cleanser, which is really lovely and gentle and soft on the skin, and then follow it up with a nice moisturizer that's not going to be too thick or blocking your pores, so non-comedogenic. Again, Cetaphil do a lovely skin cream for the face as well that you can use. Sometimes clients may find that treatments targeted towards rosacea are quite helpful in dermatitis because of the skin blood flow and how this can contribute to the worsening dermatitis and the worsening patches on the skin. So you could try some treatments targeted towards that as well, which can help. But generally, if you're repairing the skin's barrier and you're being very gentle with your cleansing, this should repair the dry, itchy, flaky skin on the skin surface that you're experiencing postpartum. Okay, so the next question I've been asked is about spider veins on the skin surface. So spider veins or spider angiomas occur during pregnancy due to hormonal changes, due to weight gain and due to the pressure in the veins, which can result in red marks and blotchy vein-like marks on the skin. Now, unfortunately, there's no over-the-counter treatments or miracle creams that will make this disappear. You can use creams which are targeted towards reducing red marks in the skin, which may reduce the cosmetic appearance of the red veins, but won't really get rid of them. So the real treatment for this will be in clinic with your aesthetic doctor or with your dermatologist, normally with the use of a laser to remove them. However, not everybody needs to go and have these treatments done, as for most ladies in the postpartum period, thread-like veins and spider veins will normally disappear or lighten within 3 to 6 months. So not all hope is lost, just wait it out and see if they disappear. How to reduce the appearance of stretch marks or how to, tighten up loose skin. So this is really important. The first thing I'll say is prevention is key. So when you are pregnant, it's important to use, a good moisturizing agent. But, in some people, stretch marks are genetic, and even if you are using all the preventative measures, you may still develop stretch marks. So going forward from that, I'd say it's really important to ensure that you keep hydrated, because keeping hydrated gives the skin the tightness and elasticity that it needs. The second thing is to ensure that you are eating a healthy, balanced diet. So lots of vitamins like vitamin C are needed, and vitamin E are important to keep the skin's elasticity and thickness and keep it bouncy. So ensuring you're eating, lots of healthy meals with the vitamin C, vitamin E, vitamin A will ensure that your stretch marks and loose skin, repair quicker. The other thing to say is obviously to use a topical cream, as mentioned, to reduce the appearance of stretch marks. And in the first couple of months, you may notice that using a thick oil, almond oil or coconut oil, can really help to reduce the appearance of stretch marks and to help with that skin's elasticity. However, we have to be realistic. In some people, the stretch marks and the loose skin will not just disappear, and you may need extra help. In those cases, go and see your aesthetic doctor, and there may be lasers and treatments that can be done in clinic to help with the loose skin and the stretch marks as well. I also have a question on eyes, so eye bags or dark puffy eyes, which are quite common actually in the postpartum period because of the lack of sleep, the exhaustion, poor circulation as well, which can lead to dark circles and puffy under eyes. So look, sometimes having dark under eyes can be a genetic thing. You may have pigmentation even before you got pregnant, and the hormones help them to brighten your complexion, so you weren't concentrating on your dark under eyes as much as you were previously. And then having had the baby, as all your hormones plummet, you start to notice your uneven tone of the skin, and your dark eyes and dry circles may become more apparent. That coupled with lack of hydration, lack of sleep, can lead to puffy under eyes as well, which can also give the illusion of dark under eye circles. So really important to ensure that you stay hydrated and that you get enough rest. I know it's difficult when you have a newborn, as I said before, but just try to get a few hours in is really important. Also really important to ensure that you are, using a appropriate creams under the eyes. So always use a thinner cream for under the eyes. Don't use the same cream that you use for the face because the under eye skin is thinner. So use an under eye cream that's formulated to brighten the under eyes. For example, Illumini by Illumia is a really good formulation which helps to brighten the under eye and reflect off light so that your under eyes don't appear as dark. The other thing to remember is, of course, if you do have volume loss under the eyes, and it's important to see your aesthetic doctor, as you may need to have or consider having injectables to replace that volume loss, which may then make your under eyes look less dark. The puffy under eyes may also be salt retention, so if you're having a lot of salt in your diet, this may also lead to puffy under eyes, so just consider that. Also, lymph, so the drainage of fluid in our face can also lead to puffy under eyes. So try using a pillow or two when you're sleeping. Lift your head slightly off so that you're not sleeping flat, and that may help with drainage of lymph in the skin, in the face, and therefore reduce your puffy eye appearance as well. A little home remedy though, so caffeine is thought to reduce the under eye puffiness. So there's a product by The Ordinary which you can try, which is an under eye solution, which is caffeine based. But if you don't want to try that, you can also try just cold tea bags under the eyes and settle them down for a few minutes when you're resting, and this can help to just reduce the puffiness under the eye as well. Okay, so I have a comment here about postnatal nirvana, and somebody has mentioned that they only thought they could get to this stage during pregnancy. So postnatal nirvana is basically a state where you are happy and content with your skin in the postpartum period, and normally this happens with your second, third child, where you recognise that actually you are going to have skin changes which are out of your control due to hormones or whatever else it may be, and that you're going to be able to deal with those and tackle those concerns with the knowledge that you have from previous pregnancies or from videos like this where we answer your questions on postnatal skincare. So I hope that this video has been useful. I hope the questions we've answered have been useful, and I hope that this video helps you to reach a state of postnatal nirvana. And if you have any other questions, you can follow me on my page at The Face Bible, where I post very regularly on all things skincare, aesthetics, wellness, and also general health, because I am also a GP. So if you have any questions, you can head over there as well. And I do hope that you all have a great week and that your skincare game is forever strong. Take care, guys.